Yes, sir. Sir, as a doctor, how is your typical day in your life, sir?
It's quite busy. Might sound like a cliche, but you mean you know that, man. You have been trying to have this podcast for like 4 or 5 months, maybe a year, right? I think you
Yes,
approached
sir. Yes,
me
sir.
like last year. It is just now come to rotation that has almost been a year to have this podcast. So yeah, I
Yes, sir.
work in a medical college in the morning. So my 8 to 3 or 4 is there. In the evening, I have my practice. Not only practice, I don't have a clinic yet, but I go around hospitals where I have patients, my own patients. So I get to see them. In the midst of it, the content creation. So content creation, as you know, takes a toll, takes quite a bit of your time. So yeah, we typically shoot on Sundays. We don't shoot every day. So I script throughout the week. So whatever I feel like, I don't follow any algorithm. I don't follow any sets of rules that this should be done this week or something. So I have an idea. I develop the idea inherently through the week. So the idea gets developed through the week, and weekend we plan the shooting. We shoot for about 1 or 2 hours. You know, the other guy who is on the channel with me is my very
Yes, sir.
very close. He's my best friend, and he's not even a medico. He's a non-medico. He's doing it because he just wants to do. He's just we're just having fun during shootings, here, basically. So we shoot in the weekends, and I send it to editors, and they get the back the scripts, get back the videos through the week, and I scrutinize the videos and they post it. So all this in midst of practice, so it's usually quite hectic. That's how it is. So, yeah.
How you entered in this field like content creation, sir? What motivate you? Like, is it something like you keep on seeing others' video? For example, as we medical, we keep on stalking other medical professionals' profiles. So
So
it is like that.
very very interesting question. So I was doing my DM. So it was like 2 years back, couple of years back. I was doing my DM. It was a final year of residency. So before that, medical content creation was not actually a thing. So once I finished my DM, so I thought I came from government setup. I came from Madras Medical College. So I passed out from Madras Medical College. So you might have known that Madras Medical College is such a high volume center, right? So the amount of cases we
Yes,
see,
sir.
amount of teachings we receive, also we do is quite a lot. So when I suddenly came out of Madras Medical College, it's like a withdrawal. So I went into private practice, private setup and private practice. Even though I had residents, I couldn't teach them much because they were just joining. A couple of residents just joined. So I felt like there's a lot of things inside I wanted to teach, but I couldn't.
Mm,
Where is the outlet?
mm.
Where is the outlet to teach? No. So I thought, why not start a Instagram channel? Some people are telling me that Instagram is now the thing, not YouTube, because YouTube becomes a longer format. No, people's attention span is constantly shrinking, right? So they want short
Yes, sir.
videos, short concepts. So I thought, why not? Why not get into content creation? And at the time, two pages that inspired me to do this, that told me that this actually works. So people were actually following those pages. Those two pages are, as you know, Health with Vishal Gabal. Gabal, he's from Mumbai.
Mm-hmm.
Uh, from Mumbai, and the other one is from Tamil Nadu. Dr. Pluripotent, you might have known him also. He is Mr.
Mm.
Venkatesh Ashok. So these two pages were doing quite good. And even as a DM resident, I was watching the videos because it's revised concepts. Not like in minute we have a concept. Like in 1 minute we have a concept. So why not? So as a DM resident, if I am watching it, it will be extremely helpful to MBBS student, right? Or a MD resident, right?
Mm.
So
Yes,
that's
sir.
where the idea came from. The idea was already there. Idea was already there. I also required an outlet to teach. So it just all came together, and that's how it started.
As much as I put effort in these videos, it didn't show up the results. So how you take these things?
So I would be lying if I said that numbers don't matter to me. So numbers, when you're in a game, you're playing a game. Of course, numbers do matter. So after some time of content creation, after creating content for like 1 or 2 months, I realized that not every video is going to do good,
Mm.
right? Not every video is going to do good. You post 10 videos, not
Mm.
everything is going to do good. But now
Mm.
I looked at from different perspective. What does doing good mean? So if someone from Instagram who saw the video texts me or comments on the video, that video helped them with a concept, helped them with a question in the exam, helped them with a viva, then I think I'm doing good. To me, I think I'm doing good. So what is good on Instagram means it is going to reach a lot of people. It has to reach a lot of people. But what is good to me, if at least one person who's seeing the video gets a clear idea of the concept, then I'm happy with that. So the point of doing on Instagram is to reach larger people, right? So of
Yes,
course
sir.
numbers do matter, and I also think about numbers. But there is one quote that Roger Federer used to say. Roger Federer, as you know, is probably the goat of tennis, right? He used to say something. So he has won so many Grand Slams. You know, I think 21 or 20. I'm not very sure. They have 21 Grand Slams, but the amount of points he won, points each point like 15, 30, 45 point in tennis. No, he won only 51% of the points. So 100% points, he has won only 51 percentage of the points. That means even the great Roger Federer has lost 14% of the points. So
Hmm.
that tells you that one point goes away. You always have a chance at the other point, right? So if one video
Yes,
doesn't
sir.
go well, we have to see what is wrong with that video. So why didn't this
Yes,
video
sir.
reach more people? So that's how that's like any other field. You got to work on your failures, you got to improvise, and you got to come with a better video.
If you start content creation, everyone feels like they have to have a very good setup to start content creation. Do you feel it's true to have a good setup
No,
when
no.
you are starting content
No,
creation?
I thought the same. That's why there's a green screen here. There's a ring light here. I bought them before I shot my first video, but no. So
Yes,
the
sir.
videos which go do well not necessarily requires all this. You might require it as you go on the journey, but
Hmm.
you don't require that to become do good on Instagram. On Instagram at least. For YouTube, because you're going to do a longer format video, you might require all those. But for Instagram, you just need a camera phone and probably a mic. So
Yes, sir.
Instagram has become more like TikTok these days. The reach is not uniform. As you say, one video might
Hmm.
do very well, the other videos don't do so well. I think my
Yes, sir.
first video, which did very good, was a video showing a tremor. Actually, it's a very mundane
Okay.
video. It's a video showing a tremor, a dystonic tremor, and suddenly went viral. And like after that, a lot of my videos where I explain concepts also done very well. But that's the first video, as you asked me, that's the first video I could recollect, which did quite well.
Which video you have put a lot of efforts in making but didn't
Yeah,
do
those
that good also?
usually don't do well. Uh, Before you ask me, the video which we expect to do well don't do well.
Yes, sir.
I think I put a lot of effort into explaining how an INO, that's called internuclear ophthalmoplegia, and about 1.5 syndrome. So that
Hmm.
is very difficult to explain. That's a very, in general, a very difficult concept to explain. More so
Hmm.
in 1 minute. So we have only 1 minute, 1.5 minutes, right? So now it is
Yes, sir.
3 minutes. It's allowed on Instagram. Previously, it used to be only 90 seconds. So you got to explain the concept in 90 seconds. So I put a lot of effort into simplifying the whole thing. It didn't do well, but as I said, my definition of doing well is different. Some
Yes,
people
sir.
really message me that they understood something of I know and one and a half. I was very happy with that. But in terms of effort, that took a lot of effort. After a few years, no, MD, DM days, you do a lot of presentations. You got to do a lot of presentations, poster presentations, platform, podium, etc., etc., etc. Basically, everything goes away. You're shameless, basically.
So even after Vivas also we become shameless.
Right, right. I actually made a series on Viva. If you can, still there on Instagram. I made a series of Viva encounters, like explaining concepts, but in a format of Viva. So Viva, as you all know, it can go quite embarrassing at times. So and there's a scope of a lot of humor there, right? Between the examiner and the student, there's a scope of a lot of humor. So I
Hmm.
have made a couple of videos on those concept too. I mean, just because you brought up the word Viva, I remembered that. Mm.
Sir, in your UG days, is there any moments where the Vivas, like any Viva that you remember, which was the most embarrassing moment in your life, like you remember till now?
There's a lot to remember, right? There's not just one, right? Especially in first year, no, where we are very naive. We don't know what is going on first year. First year is when they keep a lot of internal assessments, a lot of vivas, and there are quite a lot of embarrassing moments. One time, I think in physiology it was. I was asked the question, "What is aldosterone escape?" I didn't know, so I went outside. He told me that you go, read and come back. Okay, so like any other student would do, I went outside, asked asked the brilliant student there, and I went back in and told. and he told me throw. It's actually wrong, totally wrong. So I didn't read that. I took the answer from some other student and went inside and told. It was again completely wrong. So I actually quite embarrassed to admit that I didn't read. I didn't read in the time. I just took the answer from some other student and went back inside. So a lot of moments like that. So n number of moments actually.
So my third
I think
internal
you
was
might
going
remember
on.
better, right? You are just
Yeah,
probably
yes, sir.
still in a viva phase, right? So you will be the
Yes,
better
sir.
person to answer that.
Oh, last like when I was in first year, it was pre-finals going on. Then anatomy lab, they keep specimens. It was a specimen of uterus. So I went. I was like, uh, I studied other organs, but I didn't study that uterus how to hold. Remaining
You
all
are
I
still in
know
12th biology,
ligaments of.
man.
Yes, sir. I didn't know how to hold it. After that, I went. Sir, the professor asked me that hold the uterus in the anatomical position. I hold it some other way. He told that get lost, then study and come then. I
That
still
must have been
remember that
embarrassing.
moment.
Hmm.
Even in our finals, like there's batch wise we go in this practical. So first batch went, they spread rumor that whatever was there in pre-finals, the same what you say, surface marking, the mummified body surface marking was kept in the final exam. So for us in pre-finals, it was liver's inferior border. So inferior border of the liver was for surface
Okay.
marking. So we thought that will come because the rumor spreaded that whatever was there in pre-finals is there for finals. So
Okay.
we just prepared that thing, that liver inferior border. Then I went. I was very confident that liver inferior border is they kept liver inferior border. So the external came. First of all, I started giving introduction. Then he told, no need of introduction, directly do surface marking. Then I didn't read the question. I directly marked the inferior border of the liver.
Hmm.
After that, the examiner told me read the questions. Then it was like the pituitary duct was there.
Oh,
Sir, like when you entered MBBS in this whole time, the people are very confused. Like, should they enter in medicine, general surgery, and all those things? When you get clarity that you have to be a neurologist.
neurologist. Oh no, that is very late. See, I like medicine. I was very clear that I like medicine. So even though I had decent skills in surgery, I was quite clear by the end of internship that I was going to do a medical field, either pediatrics or general medicine. So I got into medicine, and during medicine, I enjoyed medicine so much. So actually, I didn't. It was not a direct calling, but I like neurology more than the other subjects. Some subjects I didn't like. Some subjects I did like. One of them is neurology. But there was option of giving two exams. So neurology and I wrote neurology and hematology exam in my NEET SS. I think somewhere in the middle of medicine residency, neuro cases fascinated me more. It is not like calling from UG. I won't like. It's not a calling from UG or from my mother's womb. It somewhere in the middle of medicine residency is where I got excited more by neurology than other subjects. As simple as that.
So how was your residency? Like, how hectic it was?
It
So
was again
how?
from Madras Medical College. The
Yes.
first 2 years are extremely hectic. Extremely hectic. So there was like 18-hour shifts during admission day. Then apart from that, we used to have 2 to 3 duties in a week. Apart from that, so 18 hours admission day is compulsory for everyone. Apart from that, we used to have either 2 or maximum 3 duties in that week. So this is till first year. Second year duties decrease a little bit, but responsibilities increase in second year. And this goes on till the second year. Third year is when we actually breathe, and that time that comes the thesis, dissertation, case presentation and stuff. It goes away like that. And half of residency was pandemic. Not pandemic per se. It was two dengue epidemics and one COVID pandemic and an influenza epidemic. So it went like this. So there was two dengue epidemics. Finally, we had a influenza epidemic, and then COVID came. And to by the end of our final year, COVID came.
You think that during our UG days, we should like what should we do to learn that thing of communications with patients, sir? because there are a
You
lot
got
of
to see
things
a lot of
like,
patients.
yes sir, yes sir.
See, there's something called being folksy. This term called being folksy. You got to be folksy. In the sense the patient should think of you as their own. That's how you build rapport. So there's some point someone told me long back. I don't remember exactly where I heard this point. So if you recollect something about the patient from your previous encounter, so you see a patient today, you see a patient after 1 month. If there is one point you encounter, you recollect about the patient from your previous encounter, the bonding naturally increases. The patient will go to nobody else. Patient will definitely come to you.
So,
And
yes, sir. During our clinicals, what one of our professor used to tell that when you are with the patients, actually our surgery former HOD sir one day he told during his lecture that when you are with the patients, do nothing, just like do physical examination, just touch that patients. In that way,
exactly,
you will feel a rapport with that patient, sir.
exactly. I agree. Agree. If you the patient has just come to you with pain, there's nothing to be
Hmm.
examined. Say there's nothing to be examined. But just as he says, just by putting a physical touch, it increases the bonding. It does increase the bonding. Some patients do get better without much of medications, without some placebo medications. They do get better. I agree. And also, no, you should always let the patients talk. You do the role of a listener, and that itself will cure diseases, in my opinion. In a sense, it does wonders.
Hmm.
The patients tend to go to a practitioner who gives the same medicines over and over again.
Hmm.
Doesn't do much, but they get better. So that's placebo, right? Apart from treating the disease, you also got to treat what comes along with it.
So, sir, what do you feel in India? What are the biggest lacuna or loopholes are there in patient setup? For example, when patient is there coming to hospital, what are the things that the hospital can provide to ease that, like what you say, to get treatment, sir?
Hmm. I think from a government setup,
Hmm.
from in a government setup, basically,
Yes, sir.
not talking
Yes,
about
sir.
private, in a government setup, it's basically the patient doesn't know where to go. The patient lands up in a giant government setup. They're just
Hmm.
lost. They just don't know where to go because the place is so huge. There's so many people going around and moving around the place. They just don't know where to go. They get lost. Not lost per se. They don't know where to go. They keep roaming around. Even to meet the right doctor, they keep roaming around. So I
Hmm.
wish the shunting system was better in a government setup.
In today's generation, what do you think? For example, I'm just being very specific about youngster between 20 like in their 20s, 20 to 30 years age group. What do you think are the most common neurological diseases that they are encountering due to their lifestyles?
I would say migraine.
Migraine.
Migraine is by far the most commonest. So even males, females, everyone has a migraine that is quite disabling. So I would say
Hmm.
migraine is the most common. What do you think? What do you think it is? Do you have migraine?
No sir, I don't have migraine.
You know what causes the
But
migraine? It's the lack of sleep, man. It's the lack of sleep. So we are now shooting at 10:30 now, right?
hmm,
So I'm not used to staying up, but these days, no, the generation right now have a late sleep wake cycle disorder. They usually sleep very late,
hmm,
and because they have to go to colleges or schools or somewhere in the morning, they have to turn up somewhere. So the sleep timing is very short. It's actually five hours the maximum. So I think lack of sleep, insomnia, is the major problem with this generation. They don't sleep well, actually. They don't sleep quite enough. That is a major problem. And other problem is drug abuse. They are abusing some kind of drugs, some kind of drugs or other, and they do have symptoms because of that. Especially cannabis is common drug
hmm,
abuse these days. Cannabis.
hmm.
We do see quite a lot of cases of cannabis abuse, and that is these three I think are major issues with today's generation. And of course,
Sir,
because of social media, no, social media addiction, everyone has that, and that is increasingly prevalent in today's younger generation. That is causing insomnia, that is causing migraine, whatnot.
so when a case of migraine comes, like First of all, sir, how you want to say those people, like what are the symptoms that they can know among themselves, like these are the symptoms that typical migraine patients have, sir, and how as a doctor we should approach that case, sir.
The patients usually have a headache of probably
Hmm.
few months duration, uh, which has recently increased in frequency. And usually, the common symptoms that migraine patients says are worsening by light and worsening on hearing sounds. They call it photophobia and phonophobia. And usually, they have an associated nausea. Usually, have an associated nausea. Sometimes vomiting. Not always. Sometimes can be have associated vomiting also. So these are the common symptoms of migraine. And one thing I want to clarify is patients have pain in the neck also. Migraine is not only a headache disease. It's only patients can have pain here, patients can have pain in the shoulders, but it always involves the head along with the neck, along with the shoulders. And one more myth is migraine has to be one-sided. There's no rule. There's no rule like that. It's basically a problem with the trigeminocervical system. That means the trigeminocervical complex which supplies the face, also the neck regions. That is the problem. That is where the problem lies. So it can involve both sides, can involve the head, can involve the neck also. That is how a migraine patient usually presents. And when, as a doctor approaching the migraine patient, you got to also address the comorbidities. I told you no, migraine is usually triggered by insomnia, or
Hmm.
the patient may have
Yes, sir.
anxiety, or the patient may have coexistent depression. And these factors would have been the exacerbating factor for the migraine. So unless you
Hmm.
treat this, the migraine won't get better. So I would like to call migraine as a lifestyle disease actually. So because of patients' lifestyle choices, they are not taking food at a proper time. They're not sleeping on time. These are the usual things. They're not sleeping on time. They are excessively using social media. These are usually the factors. And if the patient addresses these factors, 50% pain will get better. Rest 50% is medications.
Sir, how to differentiate, like is it a migraine or it is a spondylitis, like that?
Yeah, that's quite confusing actually in clinical practice also. But when the patient has headache and other associated symptoms that I mentioned, like photophobia, phonophobia, we usually cleanse the diagnosis of migraine. So cervical spine usually only here. It's only here.
Hmm.
When the head is also involved and the patient associated symptoms which I mentioned, like no, like photophobia, phonophobia, we make a diagnosis of migraine.
So is migraine just common in 20 to 30 years age group, or it can be more prevalent in pediatric age group also?
No, it can occur in any age. So I used to think that it can occur only in, as you said, 20 to 30 only. But I do see a lot of pediatric migraine and I do see a lot of adult migraine, like elderly migraine also. New onset migraine is above 50, above 60 also, I do see a lot. And one thing about pediatric migraine, parents are watching this. One thing about pediatric migraine is that pediatric migraine can have many mimics. So pediatric migraine need not have a typical headache. They can present with something called a cyclical vomiting syndrome. So they
Hmm.
vomit periodically, like for 20 days a month they vomit. 10 days they'll be vomit free. And this cycle keeps repeating. This is called a cyclical vomiting syndrome. And pediatric migraine can have a torticollis like presentation. They can present a torticollis, only torticollis, nothing else. And they can have an abdominal pain. They can present only with abdominal pain. They need not have a headache itself. So these are usually the migraine mimics which can happen in pediatric age group specifically.
Sir, when we talk about today's generation's lifestyle health issues, one other aspect is also there is like in today's generation, depression is very common among youngsters, sir. Like they undergo depressions, they undergo suicidal thoughts, and we may have a lot of people around us who are in depression, but usually don't speak up about that issue with others. Like as a doctor, sir, as a neurologist, how you feel like how we can know that that person may have depression or not, sir?
Yeah. So as it is mentioned in textbooks or commonly we also encounter those patients. The patients usually have loss of interest in their usual activities. So a person who enjoys movies suddenly stops enjoying movies. A person who's an avid book reader suddenly stops reading books. Uh, Say a 30 female who used to love watching serials, TV serials, doesn't watch anymore. So lack of interest in pleasurable activities is usually the first symptom. And further, if not addressed at the stage, they can develop weight loss, they can develop insomnia, and they'll be a shell of the former self. So they'll like over time they lose their own self. They can have psychotic symptoms as well. But usually starts when there is loss of interest in daily activities, and that can evolve into a nihilistic phase where they say everything is a nil, like life is nothing. They feel hopeless, they feel helpless. That's what they usually say, right? Hopeless and helpless. This pride of depression.
So can we say that over talkativeness also comes in depression? Like sometimes a person who speaks very less, but suddenly he started speaking a lot,
That's
and he
not
behaving
usually
something.
common in depression, but
Hmm.
the spectrum of depression is bipolar disorder, right? Bipolar
Hmm.
disorder means
Yes,
they
sir.
will be depressed for some time. They can have manic phase, right? And this
Yes,
can be
sir.
a manic phase presentation. So bipolar disorder can initially have a maniac phase of presentation, and that time they can have excessive talkativeness. But
Okay, sir.
depression per se doesn't lead to excessive talkativeness. Depression usually they have no eye contact. They don't make the eye contact. They don't rest properly. The word output is very less. Usually that's how depression goes.
How much money a neurologist can earn in India, sir?
So that really depends. As you have heard it before, and it really depends on which city or firm, and if you're working in a private setup or your own setup, or you're working in a medical college. So I think I'll tell you the basic money which you can make rather than the maximum. Maximum can be anything. It depends on your
Hmm.
practice. Okay. I know people who make 20, 30, 40 lakhs per month also. I know people who don't make much also. So I'll tell you the minimum which you can make. So that maximum can be anything. Minimum I
Hmm.
think is easily 2.5 to 3 lakhs per month.
2.5 3 lakhs per month as a
3 lakhs per month.
neurologist.
As of now, yeah. So if you just work in a
And
medical college and do some little bit of freelancing, any neurologist will be able to make 2.5 lakhs minimum per month.
as a
Again, that
general
depends the city
medicine.
as well. I am talking about
Yes, sir.
Chennai, and some cities are getting saturated, but I think minimum is 2 to 2.5. You can probably assume it, 2 to 2.5 lakhs.
So as you said, some cities are getting saturated. Do you think neurology field is saturated?
Uh, that's a difficult question to answer, but yeah, there is some saturation in some metro cities that they are demanding fellowships to take in corporate setup now. That is, I think, because
Okay.
the people are not moving around. So,
Hmm.
because saturation, the word exists because there is not many hospitals which can give you jobs. So, it's
Hmm.
rather than saturation. I think it's a mismatch between number of people over there, the number of people who can give you jobs, right?
Hmm.
I hope you understand because Tamil Nadu has a lot of medical colleges. Tamil Nadu has a lot of
Yes,
medical
sir.
colleges. You might have known that Tamil Nadu has a lot of medical colleges. So in Tamil Nadu, saturation
Yes,
is
sir.
not quite there because neurologist wants to get a job now, they can get it easily because there are a lot of medical
Yes, sir.
colleges around. But say a city like Bangalore, there's not a lot of medical colleges, so you got to be employed in hospitals, right?
Hmm.
So people who are in hospitals usually don't move around. They stay there for a long time. So seeing that way, for newcomers, there might be a shortage of vacancy unless
Hmm.
they have fellowships. So that is not because it's actually saturated. It's actually a shortage of medical colleges which or hospitals that can provide them a job. So if you want to start
Hmm.
their own practice, they will get a very big practice also. That won't be an issue.
Hmm.
But to join a
Sir,
medical college, that
yeah.
might be an issue in some cities.
Sir, yeah, if I say like, uh, what do you think? Which field has very good potential in upcoming years, but as of now, students are not taking that field, like very underhyped postgraduate field after MBBS
So, just talking about psychiatry. See, the
psychiatry.
only thing that is stopping psychiatry from becoming as big as it can be is the stigma. So right
Hmm.
now there is still some stigma among people that if you go to psychiatrist, you'll be labeled a mentally ill patient. There is still a stigma, but that stigma is
Hmm.
going away in metro cities. But when will the people in the suburban tier two cities get rid of the stigma? Psychiatry is going to boom like anything because everyone has a mental health problem. Either something insomnia, anxiety, depression, mania, or even just some panic attacks. Something is there for everyone. Nobody is without a mental illness.
Yes, sir.
So once that stigma goes away, psychiatry is going to boom like anything.
Sir, when it comes to choosing a field after post graduation, one thing is very underlooked is people took a lot of drops after MBBS. MBBS itself is a 5.5 years course, then they are taking 2 3 drops in order to get their dream branch. Do you think taking so many drops is really worth it, or they should continue as a medical officer, like after
But
2 3
I don't
drops?
think there's much option after MBBS, right?
Hmm.
So they can explore other options like working as like a lot of alternate options like diploma in diabetology. A lot of alternate options which they explore. But otherwise, the mainstream options are limited because
Hmm.
once they finish MBBS, I don't think you can survive for life with the MBBS degree unless you're in government setup. You're a government service person. You can't survive your whole life with just an MBBS degree. You may be
Hmm.
well paid now, but I don't think MBBS people are paid adequately now. But down the years, you will get replaced, right? So they are in between, right? So one thing you can think out of the box. You can think options like diploma in diabetology. There are other diploma options as well. MRCP, like the other options, they can look upon. But the mainstream option, you got to do a PG. That has become the scenario now because uh, just in the past 2 years, about 17 new medical colleges have been opened in the state of Tamil Nadu. So imagine the
Hmm.
number of people coming out.
Where this profession is going in next 10 years. Right now it's very overhyped. Where you are seeing this profession in next 10 years, sir? I'm telling
I
just
think
about MBBS.
I think the same way the engineering did. So it's going to become saturated. Already saturated. So there are going to
Hmm.
be a lot of jobless doctors. And I recently saw some news also. Like doctors are doing Swiggy, Zomatos right now itself. It's very pathetic to hear. Not that it's lower upon the Swiggy deliveries, but it's sad that hospitals are not able to provide them jobs. So that they have to look for
Hmm.
alternate options like Swiggy, Zomato. And that is the reality now itself. So imagine 10 years down the line that all these people are going to graduate and come out. So where is the hospitals to provide them jobs? And I don't think in tier two or even tier three cities, maybe tier three it's okay, but tier one, tier two, I don't think people are going to go to MBBS or they starting a private practice. They're not going to go to MBBS doctor. I'm very sure about that. They will definitely look for a specialist doctor. So no jobs, no private practice. What do they do? So it is going
Hmm.
the same way
Exactly.
as engineering. So the degree doesn't differentiate you anymore unless you have the skills, unless you have the knowledge to differentiate yourself. Degree is going to offer anything down the line. Even a MD degree, say an MSc ENT or MD degree, isn't going to offer you much unless you differentiate yourself with skills. So skills actually are much more needed than before when a person does MBBS or even MD or MS. Doing for namesake institution of no use. Doing MS from a DNB institution, MS from private medical college, it doesn't have much cases, doesn't have cutting chances, no use at all.
Common mistakes that a UG student does in his or her UG time, undergrad time.
Uh, Not studying first year properly. That's what I think that is the mistake I did. So I thought we came into MBBS, we are a big shot now, we are a big guy now. I was under that thought or that thought process till the second year hit me hard. Second year hit me so hard that I didn't know a lot of first year subjects. Then I had to go back and study them again. And even now, the most useful subjects are the first year subjects for me. So from a neurology point of view and neuroanatomy, neurophysiology, neurobiochemistry are so important. Because at some point in medicine, the pathology get reinforced, the pharmacology get reinforced. But where will you study the neuroanatomy? So unless we do it in first year, you won't get the you won't get the background for it. So I think biggest mistake is neglecting first year subjects is what I feel many MBBS students are doing and not doing seeing patients during internship. They prepare for entrance exams. They don't study. They don't see cases adequately during internship. They're not doing the hardship during internship. That's what I feel is the biggest drawback of this generation.
Sir, that's a very good session with you.